how loneliness and isolation impact the health and wellness of older adults and what needs to be done to reduce negative health outcomes. Western medicine considers health as merely the absence of disease. But Cantarero Prieto, Pascual Saez, and Blasquez Fernandez define it as the complete state of physical, mental, and social well-being. So how do social isolation and loneliness fit in with health? Why are healthy social connections important as we age? Many things change at the same time once someone reaches the age of 50. As Cantarero Prieto and the others state, there can be changes in finances, loss of mobility, and the death of longtime friends, among others. Now, a study by Menick and others show that social isolation and loneliness are associated with coronary heart disease, stroke, dementia, high blood pressure, depressed immune system, reduced cognitive function, and higher risk of mortality across both. But in both cases of social isolation and loneliness, there was an increased healthcare use in each one. Strictly agrees, also citing heart disease, hypertension, stroke, and Alzheimer's. But what is social isolation? What is loneliness? Are they the same, and should they be treated the same? And basically, loneliness is being unhappy with social relationships, and social isolation is having few social contacts. But according to Menick, they go a little bit deeper in describing that social isolation is a level of contact with others in a social network, specifically friends, family, the broader community through engagement in social activities, whereas loneliness is a perception of social needs not being met. So for instance, the number of actual social relationships one has versus how many they want. Social isolation and loneliness are two completely different concepts, and assumptions cannot be made that social isolation automatically leads to loneliness. We have to start looking at quality of relationships over quantity. Because as Menick and others contend, older adults may see loss of contacts as just a natural part of aging. They state that one can be lonely regardless of the frequency of contact with social network members. Additionally, older adults may adapt to a shrinking social network. And also, older adults may intentionally prune out peripheral social network members so that they can focus more on close, emotionally meaningful relationships. They also found that social network size, frequency of contact, and social participation were not consistently related to loneliness. So therefore, quality over quantity prevails regarding the social connections associated with health. So loneliness, on the other hand, cannot be ignored. Richard and others state that loneliness is common and emotionally distressing, associated with adverse physical and mental health and unhealthy lifestyles. Corton and Knapp say the health risks associated with social isolation and loneliness are as detrimental as smoking and obesity. They also agree that social isolation and loneliness are risk factors for poor physical and mental health. They also state that older adults may be more at risk due to changing circumstances in their lives as they get older. So we must look at the factors that contribute to social isolation and loneliness so we know how to prevent them in the future. Tanskanen and Antilla cite small social networks, infrequent social contacts, absence of confidant connections, living alone, and not participating in social activities as contributing factors. Richard and others also add marital status, low education and income levels, immigration status, and low social support. Menick and others agree and also cite some other specific factors such as functional impairment, having more chronic conditions, geographic factors, moving away from family, and socioeconomic disparities. Now, according to Richard and others, the people who do self-report as feeling lonely also report having many of the chronic diseases previously associated. Since Corton and Knapp previously stated that depression and cardiovascular disease are the most studied, I'll show a study here done by Valtorta and others showing that with weak social relationships, people had a 29% higher risk of heart disease and a 32% higher risk of stroke, respectively. But why? Why does this happen? Well, as stated earlier, older adults face many challenges to their life as they age, and these changes can create barriers, ultimately resulting in unhealthy lifestyle choices. Richard and others associate such lifestyle factors as smoking, physical inactivity, and non-compliance to recommended fruit and vegetable consumption, and high cholesterol, diabetes, psychological distress, and depression, as well as increased healthcare use, all being associated with loneliness. These all result in a 26% higher mortality risk according to Henriksen and others. Liu and Zhu claim that social support is a protective factor for lonely older adults. So how do we help improve healthy social connections for our older adults? Wang cites 4 things that need to be done. 1, change the way we think about aging and older people. 2, create age-friendly environments. 3, align health systems to the needs of older adults. And 4, develop systems for long-term care. Now, when referring to age-friendly environments, Wang is talking about environments that are accessible, equitable, inclusive, safe, secure, and supportive. They provide an essential foundation for healthy aging. And when Wang was talking about long-term systems, he was referring to allowing the aging to age in place, regardless of age, income, or ability level, and how to meet the needs of the aging adult when health needs change. Now, according to Johns Hopkins, there are senior centers or active adult centers nationwide that offer different activities to maintain healthy social connections. And some of the benefits associated with these include finding like-minded friends, enjoying different exercises like garden walks, tai chi, or yoga, technology classes to teach aging adults, computer classes or video games, or Skyping with family members, because that was one of the bigger barriers was being technologically challenged. And then also engaging in community service. Some other resources for older adults that they can use to find quality relationships are some websites, meetup.com or nextdoor.com. They can check with their local recreation centers or local libraries for any programs that might be going on. There's multitude of volunteer opportunities, even starting conversation with their neighbors, and as previously stated, local senior centers or active adult centers. Consulting with their personal physician can also be beneficial and helpful, as their physician may know of some programs that are available in the area. But because of the various physical, socioeconomic, and other barriers that older adults face, Menick and others contend that at a policy level, local governments need to focus resources on particular city neighborhoods with a higher proportion of older adults and lower incomes, as well as building more age-friendly communities. If we can put all of these system developments and implementations in place, we have a much better chance of reducing the negative health outcomes that older adults routinely see that are associated with social isolation, loneliness that results in depression, and therefore unhealthy lifestyle factors, which increase health risks for numerous health risk factors.